Welcome to a short video edition of the Bulletin from the Ontario Libertarian Party. In this segment, I am pleased to introduce the chair of the Ontario Libertarian Party, Michelle Lashbrook.
Hey everybody, my name is Michelle Lashbrook and I'm the chair of the Ontario Libertarian Party. I was also a candidate in the last provincial election, having no experience before, just wanting to make a difference. As well, I live in Northern Ontario and I'm a mother, grandmother, wife, and community member. So I am a huge believer in the freedom movement. I also was a huge supporter of the Freedom Convoy, spent about 3 weeks down in Ottawa. And today, I'm just going to talk to you guys a little bit about a topic that affects us all, and it's our healthcare system in Ontario, which really, I don't think it's a healthcare system anymore. It is more like a death care or a sick care system. And why do I say these things? Well, we just have to take a look around and see what we see out in our communities, right? We have a lot of unhealthy people on a lot of medication who have delayed treatments for extended periods. So, to qualify this, I'm going to use this example. A friend of mine recently went down to the States to visit family, and while there, had some problems with breathing. Now, there had been an ongoing issue for a while, and it was just a lot of delays and a lot of time in between doctor's appointments or getting in to see a specialist. So now she's down in the States. There's an issue. She's having problems breathing, goes to the hospital. They do some tests on her and say, like, you need surgery. There's a major issue here and you need surgery. So they come back to Canada and she goes into emergency here, and she's told that within maybe a year, they'll get her in to see a specialist to deal with the issue. So to me, that doesn't sound like very good healthcare. Now, on top of that, when they went to the hospital here, we're told at least a year. She said, you know, what happens if I have a major issue, like I can't breathe anymore? And their response was, well, just come back to Merge and we'll see what we can do at that time. So they actually went out to another country, took a flight to another country, and within 2 days in another country, at a very reasonable price, she was able to successfully have the surgery that she needed. So her story isn't unique or unusual. Why are we paying taxes to the extent that we're paying taxes that are supposed to go to the healthcare system? And at the end of the day, when you try to go in to see a doctor, if you can get in to see a doctor, because here in Northern Ontario, there's a bit of an issue getting a doctor. I haven't had one, I guess, in a couple of years now. My doctor, graciously sent me a letter saying that he had randomly selected me to let me go from his practice because he was downsizing. I got this letter within 7 days of asking for a medical exemption because I had two of the conditions that were listed on the exemption list when the vaccine mandates first rolled out. So if you can get in to see a doctor, usually you're not getting in within a day or two. You're waiting weeks and weeks and weeks. You get in to see a doctor and you have multiple things going on with your body, right? There's all these issues going on, and you want to talk to him about everything because you have an entire body, right? And things are related. Things function together or don't function together well when they're not working properly. So you go in and they tell you, you know what? You're only allowed one thing. So you can't book back-to-back appointments. So the one time I was like, well, I have 3 issues. They might be related. Well, you have to book 3 appointments. And I'm like, well, what if they're all related? Well, we can only take you for 1. Perfect. I'll just book 3 appointments back-to-back right now. No, can't do that either. So to me, this is just an asinine system. It makes absolutely no sense that a doctor can only see a patient for 1 issue at a time. Again, going back to the taxes, we pay taxes on everything. We're taxed to death here in Canada. And part of our taxes is supposed to go to healthcare. I don't want to pay into a system that, one, I can't get into in a timely fashion to get checked out if I need some help. I don't want to pay into a system that has rules and regulations in Ontario governed by the CPSO, the College of Physicians and Surgeons of Ontario, who, in my opinion, are just a medical mafia and dictate to doctors what they can and can't do and interfere between that doctor-patient relationship. As well, it's my money. I'm paying taxes, I'm paying money for healthcare, and I should be able to choose if I want to go see a naturopath or a medical doctor. Not be told by the government that you can only see these doctors or these people that we have decided are the only experts, the only qualified people to help you in your situation. Without having any previous knowledge of my situation, my conditions, me, my beliefs, they get to dictate that. So one of the objectives that we have with the Ontario Libertarian Party is to give people the freedom of choice on who to go see when they're ill. I think this just makes sense to me, right? So moving forward, I think that Ontarians really needs to start making their voices heard when we're talking about health care, when it's really sick care. We need to get a little bit angry or a lot angry about what they're doing with their money or not doing. A lot of our taxpayer dollars that's supposed to go into healthcare is just going to the top end heavy bureaucrats that are sitting in our hospitals on these boards and all this stuff, and not actually going to what is actually needed, which is, funding for nurses, equipment, lower wait times, better care. And just on that topic, it's 2024, and up here in Northern Ontario, North Bay Ontario, they have still not hired back nurses that are unvaccinated. So huge wait times, delays upon delays before you can get in and get care. And if you become critical, just go to the hospital, which usually at that point is too late. But let's not hire the nurses back that we, pushed out of the system during the COVID mandates. Anyway, that's about it for me, my little rant on our sick care system with the medical mafia that governs our Ontario medical establishments, the CPSO. And I'd encourage everybody to get extremely loud about this and start writing letters and get vocal. Thank you. Stay healthy.
I'd like to thank Michelle for taking the time today. Stay tuned, there's more to come. Again, thanks for watching.